Hey Mandy, how are you? I'm about to go live with the student you recommended. Hold on. Hey
Yeah.
Latoya, how you
And
doing?
oh, there. I'm well. How are you?
I'm doing good. Dr. Appleton, hey, how you doing? This is my second virtual office hours for the day. Dr. Appleton, thanks for joining in and supporting. Hey Mandy, thank you for connecting me and Latoya. Latoya, before we get started, I just want to introduce myself because I saw you got introduced to me by way of Mandy. Hey Marcia, how are you? So I'm Dr. Anthony Johnson. I don't have you. I don't know if I had you for a class, but I think I may have seen your content. I'm not sure, but
Okay.
I have a doctorate of health science, where I specialized in public health and higher education. Then I have a master's and a bachelor's degree both in health services administration, where I did my research thesis on what are some strategies to implement into healthcare facilities to alleviate nurses burnout and maintain positive levels of emotional intelligence overall. So my focus or my research focus has heavily been on supporting healthcare professionals in all aspects of whatever that entails. How are you doing? Can you introduce myself? I briefly checked out your page and I saw some of your content, and I see that you are big on health education and just being a pillar in the community. But I just want you to, just introduce yourself and tell me about your background and how can I help.
Okay. Sure. So thank you for doing this for me.
Hmm.
I am Latoya Clark. I am a social wellness consultant
Hmm.
slash creator.
Hmm.
I am also a patient advocate, and I'm also a chronic pain patient myself.
Okay.
I have a background in social work and
Hmm.
mainly education, early childhood education,
Hmm.
pre-K, special ed, and like kindergarten.
Hmm.
And then I kind of had my second act where I became a pastry chef. And so I have a BS in baking science and culinary arts and baking science.
Okay, nice.
So I am in essence a jack of some trades,
Hmm. Hmm.
and my uh, work focus really switched towards patient education and professional education for those in healthcare,
Hmm.
mainly due to my experiences with chronic pain, chronic health issues, and things like that.
Okay.
Especially being a woman, overweight,
Hmm.
and black.
Hmm.
I kind of ran to all the typical barriers most would.
Hmm.
And I've never really been one that was just satisfied with letting the status quo be status quo.
Hmm.
And I want to create spaces and creating currently a space
Hmm.
for the people who are coming after me and
Hmm.
creating the space I didn't have
Right.
when I first got diagnosed, and even currently now,
Hmm.
trying to navigate the healthcare world.
Hmm. Nice. Okay, well, that is amazing work. And like I always tell people, representation is important. Oftentimes
Mhm.
when it doesn't matter where you may be, either within school or within work, it's always good to be able to connect or have some type of representation that you are connected to. Whether that's in school, whether that's through a professor, advisor, or organizations, or clubs on campus, or whether that be your supervisor or colleagues or the type of work that you do overall. So, like I always like to stress, representation is important. So, thank you for the work that you do overall in that space. So, how this is, it's a new series that I'm starting. Hey, Sam, how are you? Thanks for checking in. It's a new series that I started where it's virtual office hours, where I want to share my acquired skills and knowledge to students like you who are interested in either going back to school or need some, career tips or some advice on professional development or what next steps they can go into. So that's why we're here today. Please feel free to ask me all the questions you want. This is your opportunity to pick your brain of a professor. So let me start off. Are you interested in going back to school, or first of all, share me your educational background and then we can go from there. Hey, Laney, thank you for joining the live.
Okay, sure. So because I went to University of Montevallo
Okay.
to pursue a social work degree.
Okay.
I I mistakenly, now I know it's
Mm-hmm.
mistakenly, I left there
Mm-hmm.
in my last semester to
Mm-hmm.
become a chef.
Mm-hmm.
So I have some of the knowledge, but never actually graduated with the social work degree.
Okay.
And then got my BS in culinary arts and baking science.
Mm-hmm.
And then after I became chronically ill and whatnot, I got certified and trained to be a patient advocate,
Okay.
and I also have a competency through Leah Formey.
Nice. Okay.
So that's the bulk of what I have right now that relates to what it is I'm trying to do.
Right. Okay, I love that. For those of you who just joined in, this is virtual office hours with Dr. Johnson. I am here with a student who is interested in either professional development, career advice, or going back to school. And this is an opportunity for a one-on-one session for her to just pick my brain, pick the brain of a professor, where I'm going to share my acquired skills, knowledge, and experience to drop gems over to Latoya and see how she can, either motivate her to go back to school, motivate her to pivot into a new career, or just motivate her to continue doing the great work that she's already doing. So I just wanted to give you guys just a preface of what we are discussing right now for those of you who just joined in. Sorry to cut you off, Latoya.
Oh, no worries. So right now, I'm not necessarily looking to go back to school,
Okay.
because I just finished the course, and it's just like right now things are still a little bit hectic.
Okay.
However, when it comes to professional growth,
Mm-hmm.
I've done a few speaking engagements and trainings.
Mm-hmm.
I've trained a group of physical therapists,
Mm-hmm.
about 25 physical therapists
Mm-hmm.
in chronic pain awareness and
Mm-hmm.
education
Mm-hmm.
on a from a patient's perspective.
Mm-hmm.
I've done that, and then I've also done a virtual conference for VAs,
Okay.
and I spoke to them about the importance of people who are chronically ill
Mm-hmm.
to, as quickly as possible, find a new dream
Right.
and to start to develop themselves despite their pain. So
Right.
I educated them on how to become VAs
Mm-hmm.
in various fields.
Mm-hmm. Question. Tell me more about the cultural competency. Obviously, that kind of piqued my interest because I did my doctoral research on cultural competency for healthcare professionals, and I created a course syllabus. That was part of my dissertation, was to create a syllabus, and obviously we had our own free range to choose whatever topic we wanted, and I chose cultural competency for healthcare professionals. So I want to hear more about what does cultural competency mean to you, and what are you doing to educate others and just shed more light on the overall topic of cultural competency.
Absolutely. So I was in one of the Hillman Talk courses
Hmm.
with Leah M. Forney.
Okay.
She's a sexual assault, I'm sorry, a sexual assault advocate,
Okay.
and she also has a big background in cultural literacy and education.
Hmm.
So the course that she was teaching really fit into me because with the work that I'm doing, I am seeing how I am coming into contact with a wide range of people
Hmm.
from different religious,
Hmm.
emotional,
Hmm.
geological backgrounds,
Right.
and I'm just a country girl from Alabama.
Right.
So there's certain things I just don't know and or understand.
Hmm.
So taking her course just helped me to understand how important it is for me to at least have a baseline knowledge of how to speak to people from different religious
Hmm.
or cultural educational backgrounds to not alienate them, because if you don't know what you don't know,
Right.
and I never want to offend someone who's already struggling.
Right.
So her course really gave me a really good foundation and helped me actually understand
Hmm.
how to create better content that
Right.
will reach more people.
Right.
How to change up my phrasing, my wording, the pacing of my talking, all the things
Hmm.
to reach different people,
Hmm.
because chronic illness doesn't discriminate.
Hmm.
At any moment in time, anybody can become chronically ill,
Right.
and once that happens,
Hmm.
the world is crazy for
Right.
a while.
Right.
And so to have that to deal with, and then you run into someone who may be unknowingly ignorant about certain things,
Hmm.
to just make it worse for you, like that's something. I don't strive to be perfect, but I
Mm-hmm.
strive to do my best.
Right. As it relates to professional or career rise, where are you at in terms of that? Not to give away where you work at, but could you share a little bit more about what you're doing career wise?
Right now, I am a entrepreneur,
Okay.
and I am grassroots. Basically, I
Okay.
send out pitches. I research different locations, places that I hear maybe that are looking for certain educational buffers to come, people to come in and talk to
Mm-hmm.
them. I
Mm-hmm.
pitch out to them. Uh, Even like currently with like some of the administrational things and policy changes as far as mobility aids and trainings along those lines,
Mm-hmm.
anywhere that I feel that is either looking for or can use the knowledge of a patient-centered chronic pain uh, training, or
Mm-hmm.
even just or even just like a webinar type thing. That's pretty much what I am doing at this point. Because like with me also being a chronic pain patient myself, I still have like my day-to-day things that I have to try to fit in to also trying to become a more profitable business owner.
Right. So, question: what are your goals right now going forward? What are your goals, or what are your next steps that you would like to work on, or what would you want me to kind of advise you on or assist you with?
So right now, I have a two-pronged strategy working right now.
Mm-hmm.
Um, Perhaps I'm thinking maybe perhaps for you it would, if with your professional background, because
Mm-hmm.
like it would help me with my speaking
Mm-hmm.
engagement type of things.
Mm-hmm.
Um, Connecting me with other either individuals, facilities, groups that are either looking for or that would benefit from
Mm-hmm.
hearing from a patient viewed outlook on healthcare,
Mm-hmm.
um, just to kind of help their staff, or even because I reached out to some schools also
Mm-hmm.
to speak to children,
Mm-hmm.
and how to help them recognize when their friend may be struggling, and then what to do when
Mm-hmm.
they are around a disabled, classmate. Because children can be children,
Right.
and so I want to try to catch them early, before it gets too out of control. So that is where I really like to start building up the muscle of me speaking to and educating in either lane.
Mm-hmm.
But like right now, I'm pushing hard really just for those professional either facilities that are looking for CEUs,
Mm-hmm.
or just if they're just needing that extra education on patient centered care.
Right. What state are you in?
Alabama.
You're in Alabama. Okay.
Mhm.
Question: would you be interested? You do a lot of community work, and based off of your page, what I saw, you do a lot of community engagement and public speaking. Would you be interested in teaching? Is that something that you've considered?
Absolutely.
Yes. Okay.
Yeah. 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 Because that really was that was one of my first careers. I was in like early childhood education for 11 years,
Mm-hmm.
give or take.
Mm-hmm.
So I definitely enjoy, sharing education and helping people in that field. Yeah.
Question: I'm trying to make you bigger. Hold on. I'm
Okay.
I'm still learning TikTok myself too. Let me not even try to play with it at all. Um,
Oh, no worries. Yeah.
I'm not even gonna do that. Okay.
Okay.
Latoya, as it relates to patient care, what will help you spread the word more about all of the advocacy work that you do? Or what is something that you are looking forward to aligning yourself with? Because seeing what your page and the work that you do, I would definitely recommend your local health department. When I
Hmm.
was working at the local health department, there was of various different initiatives that they were working on that they even
Hmm.
sent me on. I was working within the HR, but it was under the quality and process improvement for the health department of the county that I live in. So they would send me to different clinics
Okay.
to do site visits and site evaluations, but they would also send me to different areas to do presentations on quality improvement for employees of the health department. So being that, yes, Black Girl Say Something is another professor. She teaches racial disparities in healthcare, and she has an upcoming class, Healthcare is Politics. Please forgive me if I mix the name up, but I think it's Healthcare is Politics. So she is also in Florida as well too, and she teaches those two courses. So she's really a great connect for you to have
Okay.
as well. Even just social engagement and community involvement, she's big on that too here in Florida. That's correct. Okay, that's correct. So Black Girl Say Something. We graduated together, and she has a doctorate of health science too, and she's big on quality care and access to quality care as well too. So you said you want to be connected to people. That's one person you can be connected to. She has a specialization
Okay.
in global health, specialty
Awesome. Yeah, I
in
just followed her. Yeah, great.
global health, yes.
Yeah.
So yes, back to health department. That'll be a great way for you to start out. And you can, if you don't want to actually work for the health department, you could actually reach out to them and be like, "Hey, I offer this services. I offer this training. Are you interested, or do you guys have a budget for that, or what does that look like?" I will share with you that when I was working at the health department, we had weekly guest speakers who came in and spoke to us on various topics. So the health department is always looking for people to come into their either their clinics or their main headquarters and speak to either their employees or the patient population of that clinic. So
Okay.
that's definitely something that you can look into, the health department.
Definitely will do. Yeah, I will do that. That's the one place I haven't tried yet. So
Yeah,
I will definitely look into that and see
definitely.
what's going on with there.
So more into you, higher education. What does that look for you? Do you have a higher education degree yet? Or is that something you're considering, or what does that look
Um, so no, the only one that I have is my bachelor's in science
like?
in the culinary arts. So I
Okay.
don't have one in professional in the professional realm.
Okay, question. Okay, so I see why you're on here now. Have you done some research on what you would possibly consider, or have you solidified, oh, I want to do this but don't know when to start yet, or where are you, where's your head at?
So I've really been more focused on the like advocacy
Okay.
realm. So I've been doing like certifications and different accreditations like that in that realm.
Okay.
Going back to school right now,
Okay.
um, it doesn't. I don't. It doesn't. I don't see it being possible, but I mean, you never know.
Hmm.
Um, so right now, I'm really more so focused on the advocacy and just trying to build up my business because I have a program
Hmm.
where I help work with entrepreneurs who
Okay.
have chronic illnesses,
Okay.
and I help them from the mindset
Hmm.
side. I start them
Hmm.
off with helping them build up their self esteem,
Hmm.
and I help them tap into that dream and to help them to dream again, basically.
Hmm.
And then we work together to build whatever the business is they're looking for.
Hmm.
And most of the times, it that breaks down into helping them with social media, helping them learn how to create videos, how to
Hmm.
batch record, all the things like that.
Hmm.
So that's really where most of my focus has been for like the past 2 years.
Okay. Let me just pause you for real quick. We have some questions in the chat, and we also have some
Okay.
more people joining in. So welcome everyone who is just joining in. This is virtual office hours with Dr. Johnson. This is where I'm giving students and engage my top supporters and engagers the opportunity to come and speak to me, pick my brain on professional development or higher education, or just kind of assist them on what to do, where to do, and when to do it. So right now we have Latoya here, who is big on patient advocacy and community involvement work, and she's looking for alignment. You're looking for professional alignment. Is that would you say so?
Correct. Yes.
Professional alignments. Also, we have a question in the chat, Latoya. She says, what is the area of advocacy that you are focusing on or focused on?
Okay. So my area of focus is chronic health or
Okay.
chronic invisible illnesses.
Hmm.
I educate on from the patient's perspective, the
Hmm.
impact of uh, medical bias, medical, ignorance, if I may.
Hmm.
I educate from the patient's perspective to help improve better patient outcomes.
Hmm. Nice. Okay, thank you for sharing. Yeah, she does have a bachelor's of science in culinary. Question. Okay, so from the outside perspective, you have, okay, let's say I'm the health department, right? This is just a scenario. Let's say I'm the health department and you present to me your idea of wanting to come and speak to my employees, right? About, let's say, a topic on cultural competency and patient safety, or, proper bedside manner
Mhm.
practices. If I'm the health department and you reach out to me, I have a question such as what qualifies you to teach these certifications, or what qualifies you to present this information to my employees? What would be your response, or how would you respond to that?
So yeah, so my what makes me the one to do this is
Mm-hmm.
I have 10 years of being a chronic health patient. I
Mm-hmm.
also have 7 years of patient advocacy training
Okay.
and patient encounter training as well.
Mm-hmm. Mm-hmm. Okay. Um, when it comes to higher education, do you feel as though having a master's degree or a degree in what you are specializing in would help you more? Or are your certifications and your overall experience, you feel as though that would be enough to put you in the right doors, or to align you with the right people to further your overall business and further your community work that you're doing overall?
I have thought about it,
Okay.
whether or not, like, whether or not me having the certifications, going through the multiple courses
Mm-hmm.
to actually be certified in patient advocacy, and then just my own patient outcomes and or patient care experiences would be enough.
Okay.
I have thought about, if I needed more.
Mm-hmm.
Um, I haven't really gotten like a set answer on that. And primarily, and even when I did think about it, I also thought like about the time involved to
Mm-hmm.
do that.
Mm-hmm.
And I don't think I'm in a financial space or even like a actual good life space
Okay.
to take on a task as big as that.
Okay.
But it maybe was hindering me. I don't necessarily have an answer for you on that.
Yeah, okay, so I have two questions for you first. Okay, so back to Black Girl Say Something. She does teach a course in racial disparities in healthcare, and within that course, she offers a template that you could use for your proposal when you are going to said health departments or even said organizations or the bigger bag, essentially. Okay, so definitely connect with her and reach out to her, and she can share with you that proposal template.
Okay.
But I think she shares it after you complete the course and receive all of her information and resources. But she does want to share with you that she has a template that you could use for a proposal when you are reaching out to the health department, these organizations, these big companies. Okay.
Okay.
So
Thank you. I will.
yes. Secondly, master's degree in public health or master's degree in healthcare administration, that will set you up. Here's the thing: you have all these years of experience. You have all these years of personal and professional experience relating to your niche. A master's degree would be the icing on top, essentially. Personally
Okay.
speaking, I would definitely recommend that. And so does Dr. Appleton in the chat too. She said a master's in public health or a master's in health administration. I would lean more towards for you a master's in public health, being that you like the community involvement and the patient advocacy, and you can do more research as it relates to patient care and bedside manner and or health disparities. That could be more. You could have a focus on public health. Master's degree in public health, and yes, they have fully online programs available, and yes, they have programs that you can go at your own pace. You mentioned that right now it may not be a good time. Start off with one class.
Mm.
Start off with one class, and you don't have no money for it. Let's apply to FAFSA.
Okay.
Let's apply to FAFSA.
Okay.
Hold on, let me go to the chat. Let me see. Question: do you have any when you were doing your bachelor's of science for culinary, did you occur any loans?
Yes.
Okay, and you're still working on those? You're still paying those off, etc.
Right now I'm in deferment. The
Okay,
last I checked,
okay,
which was a couple of
deferred.
months ago. So.
Aren't we all? Yeah, me too. If we
Yeah.
me too. Yeah. Okay, so let's say you were to consider the idea of going back to school and getting a degree in the work that you're doing now. Would you be open to loans? Yeah, Dr.
Yeah.
Appleton said, ain't nobody paying them loans. I'm not. Full transparency, my loan amount is 99,000, but I didn't start that until I went into my master's and my doctoral program. For a bachelor's degree, it was a full ride for me. However, I started to incur those loans for my master's and my doctorate degree. So yes, but right now mine are still in deferment and ain't nobody paying those loans. Wow. So
Yeah.
Dr. Appleton, Black Girl Say Something is being transparent, and she said 302,000. Bumba Ross. Okay. And guess what? Dr.
It's
Appleton is
high though. Yeah.
yeah, Dr. Appleton is a homeowner. She owns a home and she has $302,000 in student loans. That's one thing that the people them like to scare you about. Oh, you won't be able to pay a loan. You won't be able to buy a house. They're gonna garnish your wages and da 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 da. I bought a house too. Last year I bought a house, $450,000 house, sold it and made a profit off of it. But my mortgage broker was able to do. She did her job, and instead of an FHA loan, she did a conventional loan and worked around my debt to income ratio as it related to my loans, my $99,000 loans. So
Oh.
do not be afraid of loans. Don't let student loans hinder you back on life. Don't let student loans hinder you from progressing in life.
Okay. Okay.
However, please get a degree. Please get a degree.
Thank you. Yeah.
Okay, Latoya, please get a degree. Culinary science is great, but right now you're not in culinary science. You're doing this
Right.
great work as it relates to healthcare.
Right. Right.
I would love for you to get a master's degree in health, in public health.
Okay. And honestly, like right now, like I have gone through so much just personal transformation.
Mm-hmm.
Even since like last year when things were really getting hard in
Mm-hmm.
this doing this work.
Mm-hmm.
And right now, I I may sound hesitant, but
Mm-hmm.
I'm very much open to anything because at
Mm-hmm.
this point, like like transparently, like this year is like the year that I'm gonna do all things different. Like
Mm-hmm.
I'm ready to change a lot of things,
Right.
and so honestly, like just the word master's degree does scare me,
Don't let it
which
scare you.
usually means it's what I'm supposed to be doing.
Don't let it
So
scare you. Yeah, don't let it scare you. You're there. You have all this experience. You're there. Do not let it scare you. But real quickly, I want to bring up Dr. Aberton because she's requesting to come up on live and drop some gems with you as well too.
okay,
Let me bring her up.
awesome.
Hey, Dr. Appleton, how are you doing? Good evening.
Hey, good evening. I just wanted to tap in and say that the work
Mm-hmm.
that you are doing is amazing.
Mm-hmm.
I just been kind of listening in on the sidelines. I heard you working with Auntie Mandy earlier.
Mm-hmm.
Butterfly chats. I went and looked at your page as well. And I just wanted to tap in really quickly and say, don't be scared of getting the masters. I kind of hear the hesitancy.
Mm-hmm.
But if you've been finding yourself getting stonewalled when you're trying to do a better work, it is because we live in currently in a society where that piece of paper is what the people trust, even with all of the years of experience.
Repeat that again. That piece of what?
That piece of paper is what the people trust, even with all of the years of experience.
Right.
So even if you don't, I'm not here to sell you on anything. Even if you were to take the course, Racial Disparities in Healthcare, I have Healthcare as Politics coming up.
Mm-hmm.
I was meeting with the people, teaching them, because it's not about being a healthcare worker, but about knowing how to advocate for yourself in healthcare spaces.
Right.
And the people who were healthcare workers or ones that wanted to do a great work in their community, many of the people, the participants, I'm in South Florida, so there's homework that comes involved with that. There were people in Ohio,
Mm-hmm.
Alabama, Missouri, like people all over the United States. I even had a few people in Canada, which was interesting because I'm like, y'all have universal health. But anywho,
Right.
people were wanting to know how they can go to these health departments and how can they organize and rally for the sake of racial disparities and not necessarily, like you said, something pivotal, like closing that gap, being able to bridge that gap and say, okay, people have chronic illnesses, people have these silent illnesses, things like fibromyalgia, sickle cell, and all of these diseases, these chronic illnesses, where there's nobody really understanding and being able to advocate for them.
Right.
So, once you decide to go into a space where you're in that master's program, I always like to tell people a bachelor's is introductory, right? And so because you did the bachelor's in culinary science, a bachelor's of science in culinary, that's still a science, right? So now once you do a master's in public health, how do you tie that in and say, you know what? Food is wealth, right? Food is medicine.
Right.
And a master's really does, a master's, especially with the work that you're doing, a master's in health science, a master's in public health, does really set you up to understand the ethical implications and things of that nature. So I don't want it to scare you, but I'm coming from a place of somebody who is a multi-healthcare professional. I'm a phlebotomist, I'm an optician, I'm a master health scientist, I have a doctorate in health science, I'm a WIC peer breastfeeding certified counselor. Like I'm all of these different things. And so to be able to pull that in, I personally did not see it pulled together until I got my master's. Getting the doctorate was just a recommendation of one of my master's mentors. But aside from that, if they had not made that recommendation, I would have stopped at the master's, if I'm being honest with you. But I did such a great work when it came to my work with breastfeeding and racial disparities that they pushed me to pretty much go and get the doctoral degree. So, I mean, keep doing a great work, but you'll find that you hit a couple of stone walls, and not to say that you won't be able to cross those walls, but even in the midst of doing your master's, you could be able to do still that work that you're doing and get there a lot quicker and a lot sooner. Even if you take one class at a time, you'll find it so interesting one semester in, and your mind will be blown from that one class that you, not saying you may not want to finish, you're going to want to finish because it's going to be like, oh, the information that I'm trying to translate to my demographic, I know how to translate it more efficiently.
Exactly.
And that's my 2 cents on that.
Thank you so much for coming up and sharing your perspective, Dr. Appleton.
Yeah, thank you so much. I definitely
you.
appreciate that. Yeah, I did. I did follow you, and I definitely will reach out to you a little bit more. But all of that, that you just mentioned, Dr. Appleton, is where it's as I say, it's on my bingo card. Like part of the initiatives that I have that I've been pretty much just trying to push on my own up until now. I've been trying to partner with our local farmers markets to help the fruit and vegetables that they may not use or sell to help do a food drive for those with chronic illnesses. Just like I want to fill the gaps that people, because if most people think about cancer and like leukemia, which is still kind of a cancer, but like the big diseases, and there's all these programs to help that, and they're wonderful. But there are people who are even who are in my situation or some other different situation where they have a disease. It's not going to kill them.
Right.
It does drastically reduce their capacity to live a daily life. And there's nothing there. So I definitely want to be able to effectively, fill that gap and to start showing other people that it's possible so that other people can do it in their areas. So I am definitely hearing and receiving what both of you are saying. And I'm seriously going to consider it. Like I said, and it does even it terrifies me. I'm gonna be honest. Like it's a thing in my chest. But over the years, I've always noticed like the things that typically scared me the most.
Thank you, Sid.
Are the things you got to do.
Right. Right.
And I want to add too. You're like me. You're like a gap filler, and I'll give you this example. If there's nothing else that you take away from this, not to overshadow on Dr. Johnson or anything, but if there's nothing else you take away from this Black girl has something to say. And what I want to say is that as a gap filler, when I got my master's, a lot of the things that I've published, if you just Google me, Dr. Latoya Appleton, my name's Latoya as well. Dr. Latoya Appleton, you can Google me. A lot of the things that I've come to publish along the way did not pick up for me until I got my master's. And so I want to say this with you. When I was teaching meal planning to my local community, inner city right here in Miami, and that didn't really take off. It was 2 semesters into my master's degree where I was able to publish a meal planning guide. And I didn't publish it for profit. I published it for the sake of when we were doing a food drive and teaching people how to meal plan from the food that they were getting from the food drive. That was a project that I did in school in my master's studies. And the professor liked it so much that not only did I get extra credit because I actually did the work in class, but I was able to show that I did the work in the actual community that I was doing the work for. if that makes sense.
Right.
And so she told me, you need to get this published. So I published this on Amazon. It's called 5 Easy Steps to Meal Planning. And that became a guide to teach people whether you have a kitchen or not. Some people live in an efficiency with no kitchen. Some people are homeless or unhoused. Some people don't have access to a hot stove. So the meal planning guide was teaching people how to meal plan from the most, from having the least amount of resources.
Right.
Now, again, this was an initiative that I had worked on for 6 years before getting my master's. And so while in my master's, 2 classes in, I was like, oh, all I have to do is do this and, write a proposal and XYZ and do all of these extra things. And it was like, oh, it makes sense now.
Right.
And so everything that I've published since then, I can attribute it to my master's. Having a doctorate is a whole nother monster in itself. But having that master's shows that you've mastered the skills necessary to go out there and actually do the work.
Right. Thank you for
I'm gonna leave you with
sharing.
that. That's what we do as gap fillers. We see the need and we know how to fill it.
Right.
But we need that extra
Push, that oomph.
that extra push,
Right.
that extra, qualification. We might be qualified,
Right.
but those extra qualifications or what you learn during the course of those qualifications does afford you that opportunity to be better equipped,
Exactly.
I should say.
Awesome. Okay.
Well, Dr. Appleton, thank you so much for taking the time to come and join our live.
Head out.
Some gems. Thank you so much.
No problem. Disconnect.
Oh. So, Latoya, I want to leave you with some homework, the same homework I left with. Well, first, before we do that, for all of those who are just joining in, and Sid, thank you so much for the rose. Dr. Appleton, thank you so much for the rose and the gifts. Mandy, thanks for the gifts and liking, sharing out the live. Thank you so much. For those of you just joining in, this is Virtual Office Hours with Dr. Johnson. This is where I have the opportunity where students can connect with me on one-on-one, where I'm dropping gems for them as it relates to professional development, as it relates to going back to school, as it relates to higher education, as it relates to pivoting into a career within health administration, public health, health management. So I'm dropping gems into my supporters and to my students who want help or assistance, guidance, or tips on next steps on whatever that they are working on. So right now, tonight, we're here meeting with Latoya, and she has a background in community health and patient advocacy as it relates to chronic illnesses. So back to you, Latoya. I want to leave you with some homework, not to scare you, not to pressure you, but I gave Mandy the homework assignment of giving me 2 to 3 schools to look into. So I want to give you the homework. Find 2 schools that you would be interested in as it relates to attaining a master's degree in either health administration or public health. Once again, like Dr. Appleton said, I don't want to pressure you into nothing, but I want you to leave here with an assignment. I want you to leave here with an action item. I want you to leave here with a purpose, and I want you to leave here being held accountable of something.
100%. Absolutely.
Right. I don't want to just meet with you and just talk with you and we hopping on the live and nothing is coming of it, I want you to be held accountable. I want you to message me 2 schools. Question, are you interested in a fully online program or would you be interested in going on a campus? What does that look like for you?
Right now, I'm thinking online would be better for me.
Okay, sure. No problem. So I want you to find 2 different online programs that have a Master's of Health Administration program or a Master's of Public Health program.
Okay.
And what that looks like for you, send them to me. If you can't make the decision on your own, we can make the decision together. I can help you with that as well.
Okay. I'll definitely get on that. And I definitely appreciate you listening and kind of helping me, process and digest, how I can move forward. Because I've definitely been looking for that and, trying to, I guess I just recently rebranded some of my programs.
Okay.
And I definitely can tell that people are really hungry for the education.
Right.
And, because one of the other pillars I'm looking to do is a patient education program.
Nice.
And I know, like, for me,
sorry to cut you off. A patient education program, you could do your master's research thesis on that.
oh, okay.
You can do your master's research. See, you already have so many different topics that you could do for your master's research project. You're ready for a master's program.
Okay.
But you're
Yeah,
self-doubting. Don't let that self-doubt beat you up.
yeah,
Don't let
yeah.
that fear beat you up. The fear is of the devil. Please don't let that beat you up.
Absolutely,
Okay?
absolutely. I mean, and the thing is, like, I have been asking, like, asking and praying. Like, I knew that there was something
Hmm.
I needed to be doing, or there was something I was missing. You
Hmm.
know,
Hmm.
so I definitely appreciate the connection, and I thank God that I was able to come across you and Mandy's live,
Hmm.
and you giving your time like this, because it definitely does help me, you know, make a couple of more steps forward, and
Right.
I feel good about that.
Right. Also, what I want to share with you as well, I know that there's certain discourse online, either whichever platform, either Instagram, Facebook, or TikTok. There's certain discourse currently that, oh, I got this degree and it's not doing me nothing, or is the degree really worth it? Don't let that type of discourse cloud your judgment.
No, yeah,
And that's coming from a person with multiple degrees, and that's also coming from Dr. Black Girl Say Something. That's coming from her too. Don't let
yes,
that discourse cloud your judgment of you going back to school to further your education as it relates to what you are actually working on.
hmm
Okay.
I will. I will definitely keep that in mind, and keep the blinders on, and stay
Right.
focused on what I'm going to do.
Perfect. Right. So, any more questions? Any more concerns you wanna hit me with before we end it off?
Um, no, not really. I mean, I guess real maybe like in addition, I'm definitely gonna do the homework, and I'm gonna look into the health department, because I've done pitches to like the main hospital here in my area, but I
Okay.
didn't really think about the health department. So I'm definitely gonna do that.
Right.
Um, but as far as connections and, like, maybe, real time type situations, if there's any other organizations,
Okay.
groups, or places that you can think of that
Definitely.
could
Definitely.
use my help,
Okay.
even if it comes down the pike in the next couple of weeks, I would
Mhm.
love to at least, get that little nod to kind of have them at least look at me, and then if I had need to reach out to them, I absolutely would do that.
Okay, great. Okay, definitely will. Okay, and guess what? I don't share the college that I teach at on here. First, for certain reasons, I'm sure you
Exactly.
know. But at that college, I host a variety of. Well, I created a student organization. I won't share the name of that student organization, but it's an organization that's used to build community around health management and healthcare students and allied health students
Hmm.
to connect with professionals and to participate in panel discussions. And I'm always looking for external speakers to come and speak to our students about different topics, a variety of topics. Professionals in healthcare administration, professionals in government as it relates to healthcare, professionals in nonprofit organizations, professionals working within different community health initiatives. So if you are interested in, more speaking engagements and just getting your name out there and your organization out there, that I could definitely align you with being a speaker for my group of students as well.
Yep, I would appreciate that, absolutely.
Okay, definitely. So, homework assignment before I leave with you: find two fully online programs, one for a Masters of Health
Hmm.
Administration and one for a Masters of Public Health Administration. Send them to
Okay.
me and we can discuss and we can go from there, okay?
Sounds great. I'll
Okay,
shoot you over my email in the DMs.
perfect.
And yeah, I will get on that. I appreciate you again so much.
No problem. Have a good night, okay?
All right, same to you. Bye.
Bye bye. Okay, for you guys that's still on here, this was virtual office hours with Dr. Johnson, where I'm just dropping gems for my supporters and my students. That was just Latoya, who has a great deal of experience as it relates to patient advocacy. So I just wanted to meet with her and drop some gems with her, but also do it on the live so you guys can also receive some gems as well too. I just invited Black Girl Say Something to come back on just to continue the discourse and continue the conversation. Let me see if she's available. So this will be a new series that I'm going to be doing. I'm trying to figure out if I should do this daily or do it only on the weekends. But virtual office hours will be an opportunity for you to come up here with me, pick my brain, pick the brain of a professor. If you are struggling with school, if you're struggling with a certain course, if you just want to find out what to do next or what major you should pivot into next, feel free to send me a message and we could have virtual office hours. Is she back? Okay. I just invited her back. Okay.
You asking me to come up here. What's up?
Hello?
I'm selling out. What's up?
Yeah, good evening. Thank you for joining the live. So
I
this is,
realize you being professional, so I'm professional too.
thank you.
I
This
got story time in like 15 minutes.
please. This was a new series that I decided I'm going
It's breaking
to
up.
start.
It's breaking up. Why?
Can you hear me now? This is a new series that I decided to start. Virtual office hours. I'm just dropping gems to the supporters and the students who we're consistently engaging with. I realize that outside of this creating and posting it online, they still have so many questions. They still want to find some alignment or find some guidance. So I figured that this would be a great way to further the connection with the students and this engagement overall. What do you think?
I think it's a great idea. I also think it's a great way to create the content without creating the content.
Right. Hey,
So, I'll let you know because again, I've been in the content space and I know how to, make the content work.
right.
So when you get off of here and you go into like your live studio, you want to chop it up and that's your content for the week
Okay.
where you're having these conversations with them and being able to say, okay, POV, you book virtual office hours, right? And you getting these gems, and then there's different pieces of that. It doesn't have to be too much on the personal level, but you really want like the portions where you are dropping the gems, not necessarily where the question is being asked. Because again, yes, you're on live, but I know some of it can be personal and controversial. Hey, King Camille, I'm good. Story time coming in like 15 minutes, y'all.
Okay,
The sisters is home, and I just made the little thing. I ain't post no video about it, but y'all know today me for a Saturday. Today me. So I've been in the bed since 4 o'clock. So I missed the whole day.
Oh wow, no, but you was up early this morning outside raking the leaf. Okay, we dropping the professional now. This is just friend to friend, colleague to colleague. You was up early this morning raking the leaves and doing yard work. No wonder today drained you.
Yeah. And then then I was selling this damn stair stepper on TikTok live. And we had, yes, Auntie Mandy, we did have the dance party. You asked me about that. So me and the kids like at 12, because 99 Jams do the hangover mix at noon on Saturday. So we did do our dance party earlier. I can say something for a second. I'm already late for something. No, you not late. You right on time. But yeah, the story time.
What time is your story time? At
9 o'clock. 9 o'clock, yeah.
Everybody jumping on. Everybody on here, we're going to be jumping over to Black Girl Say Something's lives at 9 p.m. for what's the topic of your story time tonight?
Oh, we got to give y'all the sistercation.
Okay, I think I remember.
That's also salacious. It's not as salacious as it sounds, but y'all know the stories be having so many damn twists and turns, and we just be like, oh my God. Like, to relive it and rehash some of this stuff is so funny. Like,
okay. Make sure you drop Dr. Johnson so she can get the coins. Thank you, Mandy. I'm actually going to make you a moderator because.
What she say? Make sure you. Oh, what that mean?
To make sure you don't drop. Let me drop you. Okay. So Latoya, once again, thank you for joining. Thank you for joining the live. Thank you for supporting me. Thank you for connecting our content day the other day when we. Well, that was yesterday. Thank you for that yesterday. I don't know.
It was just yesterday.
Yeah, I think I did tell you thank you, but just thank you again publicly. I told you in private, but thank you.
So then this is what the offline we'll talk about how I would like for us to share that content where it's in tandem. So this way it's like, it would get double the views, so to speak, but not necessarily double the views. You get what I'm saying?
Yes, ma'am.
Like when the life cycle of content was longer, it would be like, everybody posts the same thing at the same time. And everybody would see it at the same time. It doesn't work that way anymore. Right. Now we would have to post it in such a way where it's like, yeah.
Okay, sure.
So I already posted the bracelet video, the top notch hour, because Layla saw it and she was like, I need, first of all, Layla, give me a break, okay?
Oh,
Every day you need
a bracelet.
something, huh?
Leda likes a bracelet.
Oh, she's a bracelet wearing girl. If she could stack them up to her elbows,
When is
bracelets
her
would be
when is her
stacked to
birthday?
her.
When is her
Her
birthday?
birthday passed. It was March.
It was March. Okay, damn. Okay, when is okay? What,
LJ is August.
okay. I'll send. Tell them I'll
If
send.
she could,
I'll send
she
them.
would wear bracelets up to her shoulders. Like that girl
I'll
love
send them.
bracelets.
If they good behavior, I'll send them on both for Christmas.
Oh, they good kids, child.
I know they.
You know, I don't have to drop kick nobody around here.
Okay. Okay, I didn't see that you posted that. I'm gonna go check that out. I'm gonna go edit it.
Yeah,
Don't
I
forget-
posted it on to my story on Top Notch Eyewear
Okay,
over on Instagram.
Thank you so much for that. I didn't even check that out. Yeah, I've just been on TikTok trying to, perfect this over here.
Yeah, and that's what I'm saying. That's why I had to get rid of Black Girl Say Something Instagram too. But TikTok is. I love bracelets. I'm just afraid I break
I
them.
don't know if you see in my body, but on Instagram, I do have the link where you can go and check that out. OnyxLinkShop.com.
Yeah, they're really sturdy, really strong, like really good quality, like really, really nice. Really, really nice. Definitely giving luxury. Definitely giving quiet luxury.
Thank you for
Oh
that.
my
That was the intent. Quiet luxury. You hit it. Thank you for that plug. Well, I gotta see this part. Thank you for that. So, you guys, at 9 p.m., we're going to be jumping over to Black Girl Say Something Live for a sister story time. What you said, sister staycation?
Don't worry about it. It's a sister story time because y'all like the sisters more than y'all like me, clearly.
Okay, yes, Pink Camille, OnyxLinkShop.com. If you follow me on Instagram, the link is there in the bio. And you wear glasses too, so check out TopNotchEye.com as well too to support Black Girl Say Something.
They got me. They know where to find me.
We are
I've been doing
healthcare
this.
professionals and we are entrepreneurs over here. We are healthcare professionals, professors, and entrepreneurs. And we collaboratively
We're
support.
tired. I'm also tired.
Me too, I'm tired too, but make sure you stay up. You're not gonna tease the people. You're not gonna tease the people about alive and then drop asleep at 9 p.m.
I've been kind of in and out of sleep all day. Like, let
You
me
know
tell you.
what? Earlier on, my virtual hours with Mandy, she said that she liked when I'm in the chat holding you accountable on staying on track. So if you get off track,
She like that.
She like Dr. Johnson.
I hate it so
I know
bad.
you hate it, but guess what? It keeps you back on track. I gotta reel you back in.
And Camille, we do not like it because the sidebar is necessary.
Your mind be doing all of this and doing all of this. But
Yeah.
she like when I keep you on track.
I'm type A, but my brain is type B. It's
So
a
tonight on your
hard
story
thing
time,
to
I'm gonna be reading you in and making sure you stay on track. I've been needing a nap. I don't want to go back to the beach. I know the beach did look nice earlier on, Camille.
I'm going to the beach tomorrow, and I told these kids I'm gonna be acting like I'm on vacation.
Which beach?
So
you
y'all
going?
better not be out here.
North Miami Beach.
No, we're going to Fort Lauderdale
Fort
Beach.
Lauderdale Beach. Okay.
Layla already checked, made sure the seaweed low, because it be hot this time of year.
Yeah, my friend went to Haulover Beach today, and they told me it was packed.
It was packed.
Yeah.
So we planning on going while all the people is in church.
Okay. So you guys, it's 8:55. I'm gonna let you guys go. You guys have 5 minutes to prepare your snack, prepare your drinks, because
Yeah, get your wine, get your
at
drinks.
9 p.m. we're gonna be
Get your snack.
heading over to Black Girl Say Something for a sister
Let me
story
go.
time.
Let me go set this live up because y'all know I gotta get set up, child. It's a lot.
So Black BGSS, I'll see you soon. I'm about to disconnect you so you can collect your points. Okay.
Not you calling me by my rap name. Now I got a freestyle. Bye.
Bye. So once again, thank you so much, you guys, for supporting and joining. This is Virtual Office Hours with Dr. Johnson. If you are interested in virtual office hours, if you're interested in going back to school and don't know where to start, if you're interested in healthcare, please send me a message and we could book a virtual office hours and you come on up and pick my brain. I pick your brain. We collaborate and get you in school or get you in a career or just motivate you to be your best. So if you're interested, send me a message, send me a DM, and we can connect. Have a good night.